Excellent. Well, I'm so happy to have you both here on the show. And really what we're talking about today is basically establishing your foundation, but your foundation when it comes to your health. Yes, I've talked about many times on this show that I want everybody out there to see their primary care doctor at least once a year. Get your physical. And getting your physical, just a friendly reminder, does mean you need to get your labs done too. I have some patients that come in and they might not do labs. They might see me, but I can't judge what your blood looks like. Got to get those labs. So establishing a relationship with your primary care doctor is one of the most important things you can do. But then now we're talking about having an integrative wellness model. So again, leveraging people and other resources and other professionals that can take care of you and help you get to your health goals. So when we have our athletic trainers out there and our physical therapists, shout out to everybody, we want to make sure that they are part of your team. And they can be part of your team very easily. All you do is just ask. And so we're going to talk about some of that stuff. We're going to talk about some of the barriers out there because I do truly feel that you guys are an underutilized resource, but such an important resource when it comes to preventing health and other kind of chronic diseases. So I want to ask the first question to Gina. So here we go. Gina, here you go. First question. What is an athletic trainer? And then also talk about the process of certification.
Sure. So an athletic trainer is often confused with a personal trainer. I think we'll hit on that in a moment. But an athletic trainer is recognized as an allied health professional, which means we're recognized as healthcare providers. So athletic trainers do their education and clinical background in prevention of injuries and conditions, diagnosis and treating those conditions with different modalities, as well as emergency care, providing emergency care, and rehabilitation and reconditioning. Athletic trainers work directly under a physician. So in the state of Illinois, we're required to have an Illinois licensure to do so. And then for minimum requirements for athletic training, have to be a bachelor's degree, so 4-year bachelor's degree, and graduate from an athletic training program that's accredited. And there's about 300 something in the country, but graduate from there, then you're eligible to sit for the BOC or the Board of Certification exam. Interestingly, they're going to be shifting that a little bit and requiring a master's degree for all athletic trainers moving forward. So some of us will be grandfathered in, which is good. Learned a lot on the job.
Yeah, it's like, go back to school,
yeah,
what?
Like,
I can't do that right now.
Yeah, that in the next few years, they're going to stop admitting into a bachelor's program or undergrad program for athletic training and just have master's degrees for athletic training, and then someone can sit for the board.
I like how you've really distinguish between an athletic trainer and a personal trainer. Again, one of the messages that I lead up to the show, I put out a video that said, hey, an athletic trainer is not the typical trainer that you see at the gym because it's a completely different thing. And so the fact of the education and the credentialing, that's super important, that legitimizes what you're doing to contribute to the healthcare team. So again, thank you for offering that perspective because I think a lot of people may not know exactly the role of an athletic trainer. And the role can be so diverse after you have your basic foundation and your certification. So thank you for clarifying that. Tiffany, tell us, what is a physical therapist?
Okay, just like Gina said, physical therapist and allied health professional. We use tools such as manual techniques, exercise, education, modalities to help improve function, mobility, and just overall quality of life. To be a physical therapist, of course, you have to go through a bachelor's degree program. You can really choose your bachelor's degree in any kind of profession. But then it is a grad level program where it is now. Most programs are shifting to doctoral programs. I'm not sure if there are any left that are master's level programs, but again, those were doctored into master's level program. I did do mine at Northwestern, which is a doctoral level program, which they're all switching to. It is about 7 years, but I feel like it's 7 years well spent. If you truly have a passion about helping others, then that 7 years really flies by.
Excellent. So thank you for clarifying this. And again, I want people, the reason why I wanted to ask those questions, because I want people to know that, again, we're all about trying to make sure people have the right information. So I want the right resources available. And when you have certified individuals that understand the body, they know what they're doing, it's going to make everything better for you to get to your health and wellness goals. So again, it's super important. Again, we're going to talk a little bit later on about some of the common myths that are out there, some of the barriers that are out there. But it's important to know that when you think about your health you're navigating the health landscape, you're doing it with the right credentialed professionals. So here's a question.